Hello, everyone, and welcome. I think we're going to get started, just allowing for a few minutes for people to come into the room. I wanted to pass things over to Anne from the World Health Organization, who's going to get us started today. Over to you, Anne.
Thank you, and warm welcome to everyone around the world to this webinar on IPC measures in immunization during COVID. I can see we have 238 on the line at the moment. I'm just thrilled to see from every parts of the world you have joined for 1 hour of intense discussions on IPC. We live in a very strange time in COVID and during this pandemic, huge challenges for immunization across the world. We asked you to answer a pulse survey a month ago on what's happening with immunization, and the replies we got, including also updates from our regional offices in WHO, showed that data from 129 countries, 68 of those had serious disruptions of immunization programs, either suspended or seriously disrupted services. That means in calculation that about 80 million infants around the world now live in countries where immunization services are suspended. We need to, as immunization people, do everything we can to maintain immunization during these difficult times. We have, with UNICEF, issued guidances and advice from WHO, which you can access from our home site, on website on how to think and what to do, and maybe advice on how to deal with immunization services. The topic today is IPC. From the pulse survey that we got many responses from you a month ago, it was really clear that infectious prevention and control measures was the key obstacles for health workers to maintain immunization during COVID. And there were many requests for training and advice on how to best use and what PPE measures should be used during COVID. So today, after that, we worked with the WHO team, and I'm very, very grateful that Alice and April are here today to give a training session on IPC during immunization. So thank you all and welcome to this webinar. Over.
I think, Alice, you might be on mute.
Great. So thank you all very much. This is Dr. April Baller, and I'm here with my colleague, Alice Diminisuni. And we are very privileged to actually have been invited to this session today, and really excited. And we appreciate the ask about IPC, because it is critical no matter what activity is being undertaken, and extremely important for immunization during this pandemic. So with that, we will start the presentation. Over to you, Alice.
Thank you, April. So I hope everyone can hear me. Please let me know if there are any issues. So we will get started and try not to take too much time. We will be very brief about the introduction to the infection prevention and control standards and recommendations. And then I will pass on over to April to finish off the other half of the IPC guidance for the COVID recommendations, specifically for immunization. So infection prevention and control is a scientific approach and practical solutions designed to prevent harm caused by infection to patients and health workers. It is grounded in infectious diseases, epidemiology, social science, and health system strengthening. IPC occupies a unique position in the field of patient safety and quality universal health coverage, since it is relevant to health workers and patients at every single healthcare encounter. Proper adherence to standard infection prevention and control practices can help protect you as a healthcare worker, your patients, and ultimately your family and the community. The overarching IPC core components are outlined in the minimum requirement documents that we have on the WHO website. Just to give you an overview, these are the minimum requirements that should be in place during routine essential health services and during outbreaks. They're particularly important to have in place before an outbreak to ensure prompt and effective response will maintain routine services. Infection prevention and control, or IPC programs, should be implemented at both national level and subnational levels at healthcare facilities or program levels. They should include an IPC focal point at each facility. IPC programs should involve ongoing training in IPC measures, including PPE, and understanding the modes of transmission of diseases such as the COVID-19 virus. It should be ongoing and undertaken by all health workers. So these are the IPC standard precautions for all healthcare settings. These are the cornerstone for prevention in all healthcare settings, and they are a set of precautions aiming to protect both health workers and patients from infectious agents. Standard precautions are recommended for the care of all patients, regardless of their suspected or confirmed diagnosis in any type of health setting. So there are several core elements to the standard precautions. They include hand hygiene, which we've talked about a lot in this outbreak, practicing respiratory hygiene, covering the coughs and sneezes that may occur, wearing personal protective equipment according to the risk assessments that are done at both national levels and at the healthcare level, safe injection practices, sharps management and injury prevention, the safe handling and cleaning and disinfection of patient care equipment, maintaining clean and disinfected environments, safe handling and cleaning of soiled linen, and properly disposing of waste. So now we will go through some of the core ones in a bit more detail. So why is hand hygiene important? We know that practicing good hand hygiene is the best way to prevent the spread of germs in healthcare settings and in the community. There are many studies that have shown that the best way to prevent the spread of germs is through good hand hygiene practices. Good hand hygiene protects you, your patients, and your coworkers. WHO has many materials online on how to properly do hand hygiene, how to use alcohol-based hand rub, which is preferable in any health setting if the hands are not visibly soiled, or with water and soap when the hands are visibly soiled or alcohol rub is not available. The timings for each of these methods is also very important to keep in mind. The alcohol-based hand rub requires 20 to 30 seconds of rubbing the hands to ensure all the areas of the hands are covered. And the soap and water requires a bit longer, 40 to 60 seconds. And the methods of how to do this are also online in poster formats if you would like to print any of them or have posters supplied for your facilities. So next we will discuss respiratory hygiene. So this is referred to sometimes as respiratory hygiene or cough etiquette or respiratory etiquette. This can reduce the spread of microorganisms into the environment that often cause respiratory infections. So what are the recommendations for this? We recommend, if you are coughing or sneezing, to cover the nose and mouth either with a tissue or with the inside of your elbow if no tissue is available. We recommend performing hand hygiene afterwards with alcohol-based hand rub or water and soap. And of course, to stay away from others as much as possible when ill. This is particularly important for health workers because they should avoid coming to work at all when they are ill or experiencing any sort of symptoms, especially during a respiratory outbreak like this. This is very important to know, and program leaders should also be very encouraging of health workers to not come into work and to be able to take time off and not be punished for not coming to a shift if they are ill. We also recommend introductory kissing or shaking hands when ill, which is a customary cultural practice. Sorry, we want to avoid these actions, and we want to also avoid close contact with people who are ill. And if there are any ill people that have to be around others, we recommend that those people wear medical masks if they're experiencing any respiratory symptoms. So next up, I would like to talk about a very important component of standard precautions of infection prevention and control. And this will be again emphasized a bit later in the context of immunization. But in the context of regular infection prevention and control core components standard precautions, we recommend that the risk assessment is done. It is an evaluation of the interaction that it is about to take place between the health worker and the patient or recipient of that health service and the environment to assess and analyze the potential for the exposure to any bodily fluids such as blood or respiratory droplets and or open skin. The risk assessment is critical for every individual activity, and the health worker should perform a risk assessment for each interaction with a patient and determine the personal protective equipment that is needed for adequate protection. It also includes keeping in mind the 5 moments of hand hygiene, which I previously mentioned, and again, should be done for each patient each time, and it should be part of their routine care. Next up, I want to talk about personal protective equipment, or PPE. And we have again heard about this during the current outbreak, so I want to specify the types of PPE items that we will be talking about in today's presentation. Keeping in mind, these are not all the PPE items that exist, but these are most relevant to our discussion today. So the PPE items include the gown, which is a long sleeve impermeable gown that is meant to cover the body, the arms up to the wrists. So gloves, which are meant, of course, to cover the hands, and they are meant to go over the cuff of the gown if it's worn together. There are some specific tips about how to wear appropriate PPE. We will discuss those later as well. The face mask is probably the most common one that we will encounter during this outbreak, and it is very important to know how to wear correctly and remove correctly. It is meant to cover the nose and the mouth, and it is meant to be put on and taken off with clean hands, and can be used by itself or in combination with these other items. Next, I would also like to mention the respirator, which is often referred to as the N95, FFP2, or FFP3. These are usually indicated for healthcare settings that are in the context of aerosol generating procedures during this outbreak. And it is meant, again, as a mask to cover the nose and the mouth, and it offers protection against aerosols when generated during certain procedures. The face shield is a form of eye protection, which is meant to cover the eyes, nose, and mouth, and is often used in combination with a mask. If there is no face shield available, we recommend the use of goggles, which are meant to cover the eyes and are usually used in combination with the mask. Please note that both of these items, face shield and goggles, are often reusable, but must be disinfected after wear before they are worn for another person or another patient. So keeping in mind these types of PPE used will vary based on the health service provided, the individual risk assessment, and additional transmission-based precautions if they are needed. Another aspect of standard precautions of IPC is the notion of the 7 steps to safe injections. And this is particularly relevant to your group because it mentions the environments that should take place during safe injections. So it mentions clean workspaces, hand hygiene, of course, which we've gone through, sterile and safety engineered syringes, sterile vials of medication, skin cleaning and antisepsis prior to the injection, appropriate collection of sharps, and appropriate waste management. If you need more clarity on any of these items, there are also lots of documents on the WHO website which can show how to properly use any of these steps. And now I will pass over to April for the second half of the presentation. Thank you.
Great, thank you, Alice, for that great introduction. So it's now my pleasure really to take some of these concepts, critical concepts, and put them in really in the context of the COVID response. So the first thing to keep in the back of our minds is with any type of risk assessment, you have to understand as much as possible what is the disease and the mode of transmission of that disease. So for COVID-19, based on the current evidence, the primary mode of transmission are through droplets and contact. So respiratory droplets are usually of a particular size, 5 to 10 microns in diameter. And these are generated in different situations, most often in cough or sneezing, but it can also be when people are talking. And the important thing about the droplets are that because they have weight, they tend to fall with gravity. And because of that, when people become infected, it is usually when they're in close contact. So the close contact is important. With respect to contact, you have direct contact, which is when one person coughs and it goes directly to another person who's close by them. But there's also indirect contact. And in COVID-19, the literature that's coming out is showing that actually indirect contact through surfaces which have been contaminated with droplets are very important. So this can either be, for example, when it drops on on high touch surfaces, such as door handles or even desk, or very often the actual mouses that are used for the computers. But it can also be indirect when it goes on to, for example, a stethoscope, and then somebody else touches that. So in addition to these main modes of transmission, there is also what Alice was speaking to, alluded to earlier, which is around aerosol generating procedures. So these are procedures which produce aerosols, and during that time, there are different PPE, specifically the N95 respirator, which Alice was speaking about earlier. And some of those procedures are intubation, called CPR, or bronchoscopy has been used quite a lot. So just to give everybody some background information, these are reference documents that have been developed now in response to COVID, which are specific to IPC, but are also very relevant to this area of work. And these are all found on the COVID website. And the ones that particularly of interest are IPC during healthcare, the rational use of PPE. So this really goes through what type of PPE should be used by whom and what activity. And then there is also one specifically, which is on the use of masks. And just for everybody's information, the advice on the use of masks is currently being updated, and hopefully there will be a new version online within about a week's time. In addition to that, there are some excellent training modules online. These are all free and they've been very popular. We want to really just focus your attention on the one which there's a video which is on how to put on and how to take off PPE. This is very important because one of the risk factors that have been found for people becoming actually contaminated is when they take off the PPE. So all of these can be found on the Open WHO website. So now we want to take some of the information from before and really operationalize it for COVID. one of the most important areas that has been discussed previously is around the risk assessment. So this risk assessment is something that needs to be done for every activity, as was explained earlier by Alice. And for the immunization in the context of COVID, this is done at 2 levels. It's done at the national or subnational level, which is really more for program leaders. And then it's also done at an individual level. So for the program leaders, what do they need to do for the risk assessment? First, they have to confirm what is a local COVID transmission scenario. Is it community spread? Is it clusters? Is it sporadic? Then the second thing they need to consider is what type of activity is going to be undertaken. So which service is being provided. Once they have looked at this, then they define and recommend which type of PPE should be used by the health service delivery. And basically also, in addition to the PPE, also what type of IPC training should take place. So as mentioned, this is something which is done at a higher strategic level. And then in addition to that, every individual health worker, no matter what setting they're in, will also need to do their own risk assessment. This will be in addition to, of course, adhering to the national guidance. And once they perform that risk assessment, then they will also see what PPE they need to wear. So, so moving on from that, if we then look at the different types of transmission scenarios, these scenarios, for those of you that are not aware of all of them, they are actually also known as the 4 C's, and this can be found on WHO website. So it's around a scenario where there are no cases, where there's sporadic cases, cluster of cases, or community transmission. So community transmission has also been called widespread transmission. So the important thing here to emphasize is twofold. One is that the IPC activities that are to take place are the same no matter what type of transmission scenario. And these are, as mentioned earlier, adherence to the national IPC protocol, always applying the standard precautions. Screening is recommended in any types of setting, maintaining the 1 meter physical distance between the vaccinator and the accompanying family members, ensuring that the recipient and the caretaker are positioned sideways to the vaccinator, not face to face, hand hygiene between each recipient, and where appropriate, disinfection. So when we look at that, we understand that these are, no matter what scenario, the activities that be undertaken. As far as the PPE, so from the previous slide, we already discussed some of this, but just in addition to the national IPC protocols, depending on the scenario, the type of mask or the use of mask can differ. So when there are no cases, the PPE that should be indicated depends on the assessment. If there are sporadic or cluster cases, there can be a consideration for mask. And when there is widespread community transmission, healthcare workers should wear the medical mask. So when we then go and look again at the PPE items, so we've already discussed this, but just to re-emphasize, first and foremost, always to practice the hand hygiene. This is critical between every recipient. And for the PPE, the mask, as mentioned, if there is community transmission, the healthcare workers should wear the medical mask throughout the immunization session. Eye protection is not routinely required. However, if there is a risk of splashes from droplets or bodily fluids, then this should be used. This is why the risk assessment at individual level is critical to do in addition to the program level. And scenarios where this could be considered is for oral vaccination, when self-administration is not possible. And with respect to the gloves and the gowns, well, once again, these are not routinely required and only if there is a risk. One of the critical components for IPC to actually work, to be accepted, is the communication around these activities. This is an area that we're sure that you're all very familiar with, but we wanted to reiterate it because it does have implications for the success of being able to implement some of these measures. So this is very much around community engagement, to allocate sufficient time to engage community leaders and the mobilizers around the vaccination site, to ensure that the community mobilizers are trained in IPC measures. This is a way to gain acceptance within the community. And also, with respect to risk communication, ensure the safety measures are communicated prior to and throughout the campaign, and that the messages needed to be adapted to immunization campaign for the outbreak context. So how to set up a safe vaccination site? It's very important to pick a well-ventilated area, preferably outdoors, to ensure that there's enough space for the flow, unidirectional flow of the recipients, and to maintain the physical distancing. This is including also within the waiting areas. It's very important there's always hand sanitizer or hand washing station available, that screening is being performed to ensure that in case there is anyone who fits the definition for COVID, that they are managed appropriately. And then finally, always ensure that there's an adequate space for the sideway position of the recipient. As far as screening, screening is intended for the early recognition of possible COVID cases. For the screening, as far as the actual flow, it's very important that this is one directional. And as you can see here in the photo, people are lining up, maintaining their distance, and they go in and then they come out at another area. There, if it's feasible, posters should be put up so the recipients understand and are very well aware of which symptoms are related to COVID. And masks are required for screening by health workers if 1 meter distance cannot be maintained. So if and when a suspect COVID patient is identified, what does the vaccinator do? So in addition, this is just briefly for people's information. In addition, obviously, to the hand hygiene, they would wear the gown, they would wear the gloves, which they potentially wouldn't have on already, and then the eye protection. And finally, just to conclude, for outreach or campaigns, we do recommend that the team take an IPC kit with them. This is in addition to the vaccination supplies, and it's more of a precaution. So the concept is, if there would be a situation where there was a potential a suspect COVID patient, you want to make sure that the vaccinator can protect themselves managing that patient or that case. So what would they need to take with? Always alcohol-based hand rub and all of the other items of PPE that we discussed, which is the medical mask, the eye protection, gloves, gown, and very important is a garbage bag. With that, we thank you very much, and we turn it back over to the moderators.
Wonderful. Thank you so much for your presentation. So we did receive a few questions in advance of the webinar, which we had sent to panelists. So I think we'll start with those questions first. And then I know a number of you have also shared questions with us in the Q&A box. So we will go in order of those that have been upvoted, and we will address as many as we can. Back over to you, Alice, if you want to address those first questions that came in.
Sorry, the ones on the Q&A or the ones that you had previously sent?
Sure, so just the ones that I had previously sent, the ones that came in before the start of the webinar.
Sure, sorry about that.
No worries.
So we did address a lot of them that came in about the PPE that is required during these types of vaccination sessions and the different types of settings. So we hope that we answered all of those appropriately, but please let us know if there are some specifics that need to be mentioned. One question I guess that that is relevant and we maybe didn't address during our slides, it was the question that came up on how to best schedule some of the appointments so that there's not too much crowding in the vaccination sites or the centers. And so this was a really good question, and thank you for posing that, and we will definitely include that information in the slides in the future. I guess we do recommend, like in workplaces now, we are recommending for less people to come in all at the same time and to really stagger out the groups. So our recommendations would be, with this in mind, that either vaccination times are scheduled for certain groups, if that's possible. Obviously for certain individuals would be best if you could schedule them so that they come in at an appropriate time. Or if you schedule just vulnerable groups at specific times, let's say first thing in the morning, you would schedule the most vulnerable, those who have comorbidities or other immunocompromised individuals. If you know of them ahead of time, schedule those first in the morning, and then you would schedule the rest of the groups afterwards.
Thank you. Yeah, thank you, Alice. And maybe just to add on, obviously depending on the context, we actually hear that right now the telemedicine is becoming more and more common. Obviously for giving vaccinations, that's not feasible, but sometimes it can be also a way to really ensure that the right people are coming for the right thing and not for non-vaccination purposes. So this is something that also could be taken into consideration. Over.
I noticed, April, there was a lot of questions specifically geared towards children and the wearing of masks for children. So I was wondering, how would we address that question?
Yeah. So thank you for the question. And really, with respects to mask, it's not something, depending on the age of the child, this is what's most important. But really, we really don't recommend it for the very, very young children. And there's several reasons. First of all, is because there has been some cases where with the young, they find it difficult to breathe. The other thing is they really feel it's difficult for them to wear it properly, and then they often contaminate it. So it's not something that we would strongly advise for.
And keeping in mind, if the health workers are wearing the masks and those in the centers are wearing the masks appropriately and keeping sufficient distance, the health workers will be at less risk of getting something if the child does in fact have COVID. Mm-hmm. So just keeping those in mind, that we are trying to put protection measures at many different aspects.
Mm-hmm. And maybe just an add-on to that, some of the literature coming out is showing that the incidence of COVID in the children seems to be lower than with some of the other diseases. I think they quoted something like 3 to 4%. It could be a bit more. I don't know if we have our UNICEF colleagues on and they can give us the exact. But it seems to be something which is not happening as much in children.
Some other questions that we noticed was a common theme as well, was that of disinfection. So there were some questions posed about how to disinfect and should they disinfect the chairs, the tables, and the commonly used areas. And so that is a part of infection prevention and control that was mentioned in our presentation. But just to touch on that again, unfortunately, I'm sure in many of your settings, there are not available cleaning personnel, especially in the outreach or mass campaign settings. So unfortunately, it is up to the health worker to also disinfect after they use the space. So if there are chairs or tables that they are using, we do recommend disinfection. And there is specific information on what types of products to use and what type of procedures to use in the documents that April mentioned, as well as in the training online. So please go there for more information.
Yeah, and Alice, just to add on, this is once again to emphasize how important it is to do the hand hygiene between every recipient, and that there is some information or some data on how long the virus can stay. It has for the coronavirus in general, not specifically for COVID. Some of the literature is showing it can stay for quite a few number of days, up to 9 days. However, under the laboratory, now that they have been looking specifically at COVID, it has been anywhere from a few hours to up to 72 hours, depending on the material. So this is once again just to emphasize the importance of cleaning. Having said that, the coronavirus, the COVID-19, or SARS-2, to be more exact, is a fragile virus, which can easily be eliminated by cleaning with soap and water, and then 0.1% chlorine. So it's not needed as at a high concentration as used in some of the other diseases. So it is relatively easily eliminated, but it is important to do this process.
Thank you. So I hope we answered most of the other IPC questions in our presentation. So maybe we can take some of the ones that are on the Q&A, because I noticed there are 34. So I think Liz or someone else, if you wanted to moderate those ones.
Yes, can certainly raise those. So I think one question we had was around IPC recommendations for water scarce environments. And they were just wondering what those recommendations are from WHO.
Sorry, could you repeat the question? What are the recommendations with respect to what?
What are the IPC recommendations with respect to water scarce environments?
Water scarce environments.
Oh, for hand washing, sorry.
Mhm. Yeah, so that's a good question. First of all, we will always advocate that there should be water. Without basic water, we don't have anything. So it is something that is critical, and not just for IPC, but for everything. So this is, but it is something that can happen. And really, that's also why we recommend the use of alcohol-based hand rub, the gel, as this is something which is very effective and can be carried around. So the soap and the water are particularly important if the hands are soiled, but often in these situations, it won't be something that happens that much. So alcohol-based hand rub is an alternative. Over.
Great. We have another question that came in. So how do we address the apprehensions of parents for COVID-19 by modifying dropper usage guidelines while administrating OPVs? One, continuing one dropper per vial policy unless contaminated or damaged, or by adopting one dropper per child approach, which may not be feasible.
Hi, it's Vachagan here from Polio Program. I'll take this question. So thank you, Fazal. It's a great one, and trying to answer it briefly. The solution to this and the contamination of dropper is a real risk that we'll need to manage in the program. It will depend on the risk assessment, and the risk assessment was described in this document. So essentially, when program leaders, when program team decides on the strategy of delivering the vaccine, we will have to tackle the solution for preventing dropper contamination. And there are several solutions for that. One, if the caregiver administration of vaccine is feasible, either by using single-use spoon or spoon provided by a community in some places, drops are put on a piece of sugar, then it's feasible to observe physical distance and the dropper does not get into direct exposure to the child, and therefore contamination could be eliminated. In other environments, the teams may decide to procure spare droppers, do their best to avoid contamination, but replace if the contamination happens. So Again, it will depend on the context, and it's for program teams to decide how to manage that real risk over.
Great, thank you. We have another question in from Shalini. She says, a lot of people are making handmade masks with various types of material. Are there guidelines for the general community as to what materials and layers of cloth should be used to make the mask? And then a second part of her question, most N95 masks are available without instructions or have instructions in foreign languages in my country. How should one gauge how many hours they can be used or reused?
Great, so thank you for those excellent questions. With respect to what we term non-medical mask, they're also known as cloth mask or handmade mask, this is obviously an area which is becoming more and more important, and particularly for this outbreak. And prior to this, there wasn't so much literature on the cloth mask. However, right now there has been a research group at Stanford who have done some basically looking at different types of fabrics. And what they are seeing that the non-woven fabric, so polypropylene, which is synthetic, is the ideal, and it's most, should we say, it's close to the medical mask. Having said that, there are many other types of fabrics that can be used, but the barrier that they provide decreases. And this is linked to really the web, so how much the fabric, how closely it's knitted together. So there's cotton, there is also silk, there's nylon, and depending on what fabric is used, depending on which combination of fabrics is used, and depending on the number of layers, all of these things affect what is the basically how well it works. This information will be in the updated guidance we were speaking about for mask. It is to say that it's not straightforward because there's, in addition to it being effective as a barrier, if it's too tight, then it becomes difficult to breathe. And we've noticed there's a few comments in here about, finding it difficult to breathe. So there's a fine balance between the two. However, these are things that do provide some level of what we call barrier, and can be used in particular for what is known as source control, which is when somebody's infected and trying to prevent them infecting somebody else. There was another question.
The second part of that question was regarding the N95 masks. So just keep in mind that in this scenario, especially for the immunization settings and vaccinators and others involved in the vaccination process, we are just recommending medical masks. We do not recommend the use of N95 masks unless the health workers are in the presence or performing an aerosol generating procedure, as we previously mentioned. So I would be focusing on medical masks and acquiring those in your country. If you want advice on how to wear them and how to put on and take them off, there is guidance of this on the WHO website. There are videos on how to do this properly. And regarding the extended use we discussed you can wear a medical mask throughout the shift that you are currently doing. However, it must be, if it does not get touched or damaged or become moist during this time, once it does, it should be removed safely and disposed of safely, and a new one should be put on. And then it should be disposed at the end of every day or shift. We do not recommend the reuse of multiple days for medical masks or the disinfection of medical masks, as we have seen from some studies that it is not as effective when this is done. And we do not recommend it.
Thank you. And maybe just to add on to that, there is in one of the guidances that we mentioned earlier called the rational use of PPE. And there is a table which does describe the different types of PPE to use, but it also looks at when there is critical shortages of different types of PPE, you know, what are some of the alternatives that can be used, and also for extended use of particular PPE. So thank you, and back to you.
Great, thanks so much. So we have several other questions that came through. One of them is a kind of a suggestion about there being awareness for the community, or to the community, on how to dispose of PPE. They said that a lot of non-medical people, i.e. local community members, are wearing self-purchased PPEs besides masks, including face shields, bodysuits, and gloves. Is there something available from WHO for the general public on these lines?
So thank you for the question. It's a good question and not easy to answer. To be honest, you know, it depends very much what the PPE is being used for. So normally in the WHO, we discuss PPE. It's in the context of, you know, healthcare workers and in the context of a healthcare facility. And then you would identify your waste either as being infectious or non-infectious. So when it starts to be used in the community, it's a bit more of a challenge, because you need to understand why it's being used and by whom, and if it's somebody who's sick or just somebody who wants to protect themselves, and then what exposure they have. But having said all that, I think there is nothing really we have right now in the guidance on this kind of context. There is a little bit of information in one of our guidances on home care. And really there, what we would suggest is to remove it and put it in a waste bin, in a waste garbage bag, and ensure that it is well closed. Back to you.
Great, thank you. We have a question from Ahmed. If parents don't come in with PPEs in routine immunization, either at fixed centers or outreach, then which strategy should be adopted by the vaccinator?
So we do not recommend PPE for the recipient being vaccinated unless they are ill. So if that question is towards health, or in the context of the recipient and their caregiver not having any respiratory symptoms, we recommend all the measures that we stated in our presentation, which include, you know, the physical distancing from the caregivers unless they're holding the patient, the sideways positioning of the recipient to the vaccinator so that they are not face to face. We recommend the hand hygiene, of course, for both recipients and health workers and the caregivers, of course, as soon as they enter the centers. The disinfection after recipients. So all of those measures speak to this and speak to why PPE is not recommended for the recipient and their caregiver. If they are experiencing symptoms, and this is noted upon screening of the individual, then of course we recommend that the center has PPE for the health worker and a mask for the recipient or their caregiver to give them to wear the mask. But there's no additional PPE that should be worn by the recipient or their caregiver. I hope that is sufficient and clear. Thank you.
Great, thank you. So we have a question from Bosco. Are all stakeholders on the immunization supply chain aware with this risk assessment process?
So from our end, we hope that we address that during our presentation. And from my understanding, this will also be transformed into a more of a training module, and I will work with the immunization group to assure that these components are all in there. But we are hoping that the immunization group can also do this education and training further on to ensure that all stakeholders are aware of the risk assessment process. And if anyone would please like to jump in here from the immunization group.
This is Diana. So Alice, I think you've answered it well. So I think the spirit of the question is just making sure that the actual supply of PPE is available where it needs to go. So as you said, this deck, and there are actually many slides that Alice and April were not able to show because of time constraints. This will be converted into kind of a training pack that would be made widely available through Boost and through WHO and UNICEF and immunization partner channels. So to the extent that all can share this information, so you help us inform those you're concerned about, that would be much appreciated. Thanks.
Great. So we have another question on just clarifying the recommendation for use of gloves. Would someone be able to do that?
Great. So thank you for that very important question. It's something which is so pertinent, basically just going back to Diana's point also around, the supply of PPE. The most important thing is, as was mentioned earlier, is the risk assessment. So when the individual vaccinator is going to do the vaccination for the recipient, they have to do their risk assessment. And during that risk assessment, one of the things they will look out for is to see if the recipient has any open wounds, any cuts, which basically would expose the vaccinator to bodily fluids. If this is the case, this is the indication to wear the gloves, because the gloves will, as Alice mentioned earlier, protect the hands. So this is when the gloves are actually used. When there is the skin is intact, then the gloves are not required. So it's very important that that for everyone to really appreciate this. Often there is a sense of, should we say, of false security when people put on gloves. And really one of the practices that is seen a lot, not just by our health workers, but even by the general public, is that people wearing gloves and walking around. Unfortunately, if the gloves are worn, they become contaminated, just touching one surface of one person. And if those same gloves are then worn and touch another surface or another person, they actually become a source of transmission of the infection, of the potential infection. So it's just to say that there is a very important indication for gloves, but it's also to be aware that that the gloves should be used when there is an indication, and not for anything else. So I hope that answers. Back to you.
Great, thanks so much. So we just have a few minutes left of the webinar, and we have a couple next steps. So I'll invite Jen Seiler from the Boost community team to share those steps with the audience. And if Alice, if you could go to the next slide, that would be great.
Thanks so much, Liz. And thank you all for joining us this morning, this afternoon, this evening, wherever you're calling in from. As Liz just said, I'm Jen Seiler, Director of Global Community Engagement at the Save and Vaccine Institute. And just wanted to share quickly, we've highlighted here our next steps on the slide, but a few things, and I know a lot of questions that came in on the Q&A and in the chat are, will we be able to get this presentation afterwards? Will we be able to get this, the recording, the deck, answer any of our questions after this, because I know we have not gotten to everyone's questions. So we will. So on boostcommunity.org, we will post the content, so the recording of this session, as well as the PowerPoint itself. We are also planning to translate the webinar into French and Spanish in the next week or so. So watch out for those that you can share with your colleagues. We are also going to share out all the questions that you guys put in the chat or the Q&A, whether they were IPC related or not. I know we got some questions about vaccine development, community engagement, vaccine hesitancy. We will post all of these questions inside a learning group that we've developed on Boost, which we will have highlighted here, kind of the link, but we will send this all to you right after this webinar. So please join us there to continue the conversation. In addition, in the next, I think, 2 days, so by, well, it's Friday today, but by Monday, we will be sending out, alongside WHO, another pulse survey just to understand where you all are, what your questions are, where vaccine services are in the communities where you work and live. And so please look out for that. Again, we will be sending that out in the next 48 hours or so. Would love to get your feedback there. We will also be sending a very quick survey out after this session, which will also pop up once you close the webinar today. So we're really hoping you can join us on Boost to continue this conversation. We're hoping that you'll continue to answer surveys. I think your feedback and your questions are invaluable. We're really doing our absolute best to try to provide you with the answers and support that you need during this really challenging time. And we hope that in the future, we'll also be able to provide additional webinars and other content to support you and your teams. So really appreciative. Thank you all to the panelists and to all the attendees today. We are looking forward to continuing the conversation online and hopefully again, live through additional webinars. So everyone stay safe and well.
Thank you so much, Jen. This is Anne again from WHO. And I really want to thank also Sabin Institute and the Boost platform about hosting this seminar together with WHO. Bye-bye, everyone.
Bye, everyone.